The Democrats, I don't know where the hell they're going. They can't even pass a watered down Build Back Better, which is greatly watered down, which is what you were saying, Andy. But yet the Democrats can give additional money to the defense budget that wasn't even asked for by the administration. So I think, Andy, you're on the trajectory that I'm on. It's like basically the Democrats are trying to do nothing as quickly as possible.
Yeah, I'm only interjecting because it's like my family, we were counting on that child tax credit thing. Like, it's a big bummer. I just told my wife tonight, I was just like, it's going to expire this year. And my wife's like, crap, and also, and I've been like MIA for the last 2 years because I became a dad in 2019. So that's why I haven't been at these meetings, but I finally was like, I want to, like, I've been reading about this stuff, about this privatization of, or what Wall Street wants to do with Medicare. And it scares the crap out of me because I think, like, once they do it, if they do it by 2030, I feel like it's going to be impossible to undo it. I'm very scared of that.
Right.
And if you remember my background, I go to the VA, and so I know that so-called, quote, socialized healthcare works. Like, I prefer the VA to the private sector. And I'm not saying that we need to do the VA for everybody in the US, but I'm just saying that, like, like I watched, like, my wife's healthcare versus mine, and it's just like, privatizing it is not the way to go. I don't think. Not that the VA, I know that's an old can of worms, but I mean, like, I'm very fearful of if that happens, which it's by 2030, right, is when they think this pilot program will be for letting Wall Street become the middleman for Medicare.
Mm-hmm.
I think it'll be really tough to undo that.
You mean the DCE, thing?
Right. I couldn't remember the acronym. Yeah.
I think there's a whole outcry is building up against that. So I think that can be stopped in its tracks if we don't let up the pressure.
Well, I think one thing that's really disturbing, I can't remember, I think, Dana, you said this at a board meeting, that section of the ACA, which talks about innovation, which is part of the DCEs, are supposed to be innovative. I think, Dana, you said, because I haven't read it, I didn't go in to look for it, that basically Congress has nothing to do with it. They can't undo it. They can't do anything about it. Is that correct, Dana?
That is correct. And I talked to Steve Campbell, who's really the guru on this. And he said the only way you're going to get that provision struck from the ACA is to get it struck from the ACA. So Congress can do that. They can strike that. They'd have to reopen the ACA and get rid of that CMMI, which is just Center for Medicaid and Medicare Innovation, it's called, which says that you can float a program out there that provides health care as long as you keep the same benefits that the ACA has, but it can't cost more than the ACA costs. Mm-hmm. So they're limited by cost. And so what's going to happen? I don't see how they can pass this DCE thing, because that's not going to decrease costs or keep costs the same. It's going to be more expensive. Flies in the face of reason.
Well, I agree with you, but I think they're saying it's a demonstration project. So we're going to give these people basically all the benefits in Medicare Advantage. And when they have those and are not paying anything more, then it'll be hard to take it away.
They might not be paying as much, but they're certainly not going to be ultimately getting as much if they need to use it for something really serious. That's the issue.
Yeah.
Right. Although some of the early ones are getting people to sign up now, and yet they can still see any physician they want to. They're still technically on traditional Medicare, and they're not subjected to networks and this and that. But I'm not sure that will hold up when it comes to private payers who may throw up roadblocks. But it's being billed as you can see anybody you want, which is one of the things that traditional Medicare people who have not gone into Medicare Advantage, one of the main reasons for doing that is so you do have free choice of doctor and you're not stuck in whatever network. So we'll see.
The same thing happened when they started doing Medicare Advantage programs as well. They did it because they thought they were going to decrease the cost of rolling out Medicare for people. How do they think this is going to be any different? I have no idea.
Oh, because private is always better and cheaper and government is inefficient.
Well, they've shown that
Right.
Medicare Advantage is more expensive. We know that. It's way
Yeah,
more
but they
expensive.
just refuse to face that and they obfuscate the whole thing.
That's why I'm saying it flies in the face of reason. They're just hypocritical.
It's ideological.
Well, I think it's worse than that. It's worse than all of that. I think they are basically grabbing everything they can possibly grab, privatizing everything they can possibly privatize. They would do the air if they could. We're stuck like just kind of looking at it. And as soon as we try to do some activism around one schism of theirs or another, they're on to something else. I mean, I think this is like the most problematic time that we've ever seen in our lives in terms of the political direction, the lack of any opposition to the two corporate parties. And what they're trying to do ultimately is give our entire lives away, take everything out of the public sphere, privatize it. That's what's going on.
The fact that it's this whole plan of privatizing this current thing that Biden's not taking action on, this is a vestigial thing from the Trump administration, and pretty much everything that Trump did. He was a political neophyte. He didn't know what the heck he was doing. He was just dismantling things right and left. And I mean, I don't know how it is on your taxes. I'm still paying for the taxes that he didn't want to. I pay more taxes because I'm under that threshold, which is, it's weird. It's like, this is your delayed taxes that him and Manchin had done, which I've read articles saying that he purposely did that because he was trying to underfund things like Social Security and Medicare. But I mean, like this is from Trump's presidency. So of course it's not supposed to be efficient. It's not supposed to work. It's supposed to undermine, and I've met people from Wall Street where they cannot, not this particular program, but they just view the government as a source of money,
Mm-hmm.
And we're supposed to take it on faith that they're not going to cut care to people to help their bottom line. I think we know they most likely are going to decrease care for people. And, there's no reason to think that this will improve care. And none of the deficit hawks in Congress have ever proven to really care about the functional, if it affects their donors, then they're like, oh no, it's about the free market and it's about government efficiency because private's better. But that's just like rhetoric and propaganda to smoke screen for their donors. I feel like it would be naive to expect that. I don't know why involving Wall Street would to scrutinize, to be a middleman. Nothing they have done has made me want to give them that faith, I guess. So, but the biggest thing is why is Biden continuing something from Trump's presidency? That's pressing on Biden.
I don't want to keep us off of some other things that I know David and Sherry want us to talk about. But basically, I think the mistake is, and Andy, I think you've disappeared, is that people need to remember who Biden is, who Biden has always been for 50 years. It's not like, why is Biden doing this because that's what Trump did. That is who Biden is. Look at his history for 50 years. That is who he is. He is a pro-private sector guy. Corporations reign supreme. He's from Delaware. He has screwed the consumers around credit cards, interest rates. That is who Biden is. He is not the friend of the people. Never has been.
Good point. I'm just saying that I think he's at a point where the chickens are coming home to roost. The more we don't take care of the general public, the working class, the disappearing middle class, that's going to negatively impact his presidential legacy. And letting Wall Street gut Medicare, that's not going to play out well for us as a society. It's not. Even if you're rich at this point, I mean, maybe if you're rich, but it's going to have crimes up. They show that people are sick of all the crime going on in Seattle. Well, it's related to the broken social issues.
Absolutely.
If we're going to gut Medicare, that's not going to bode well for us, even if you're rich. But anyway, I'll get off my soapbox on that.
I think we know what the goals are. The question is, how do we get there? And I think there are more and more people understanding it. you look at people who are in favor, quote, in favor of Medicare for all, not knowing exactly what it is, but they're the people that we need to bring over into a more activism, mode and understand more what it is and how everybody needs it. I think 2022, we've got some marching to do, some organization building and, grassroots organizing. So we can't say, well, it's hopeless. Otherwise, we wouldn't even be here tonight.
And we also can't say it's hopeless unless we're ready to leave the country. I mean, what are you going to do? Vote for the Republicans? Throw your vote away?
Sorry, I don't believe in throwing your vote away. That is a trigger for me, Sherry. Sorry.
Okay.
Not a good thing to say.
Is Susan Rogers really going to be able to meet and negotiate with CMS people? Does she seem confident?
I wouldn't say negotiate. I think they're going to have a meeting, with Liz Fowler, whoever is in HHS. 5 or 6 people are going to, they got a meeting out of that demonstration they put together.
I think the main thing that PNHP can do is to try to help to organize and give voice to the need to stop all of this privatization stuff that's going on and use our voice on Medicare to do that and just try to stop that, at least for now. And then from there, we can maybe, if we build enough of a movement, we can start to push for improving Medicare enough to make it a decent insurance for everybody. I was hopeful at the beginning of, 2 years ago, I guess, by improving Medicare, adding, vision, dental, hearing, putting a cap on the amount of out-of-pocket costs and giving prescription price negotiating power to Medicare, that if we did all of that, it would really make it into a top-notch insurance product where people wouldn't need to buy Medigap policies on top of their Medicare. And then it would be much easier to sell it to the idea that this is the insurance that should be available to everybody. And that's being undermined by their nibbling away at the improvements to Medicare that they put in the BBB. And it's gotten very discouraging. But we are getting somewhere with pushing on the DCEs. TNHP is getting some respect as a result of that. So trying to build our membership and our voice is important.
PNH is a much more solid organization than it was a year or 2 ago. We're going to be hiring a second organizer that's going to focus on supporting chapter activity and so on.
I was on a mobilized Seattle call November 23rd with 2 aides to Cantwell and Murray. And she said there's no Medicare for all bill in the Senate.
That's right.
There isn't.
Sanders is supposedly working on one.
So that might be a nice angle, is to recruit somebody in the Senate or a bunch of people in the Senate. Maybe somebody's leaving and they would do it as a.
To Carmela's credit, she did start, she's circulating a letter about this DCE issue, opposing it, and she's asking to get co-signers. I don't know how many she's gotten so far, but I think she started that yesterday. Whatever they can do, I guess Carmela's trying to get something going in Congress, but I'm not sure what they can do.
Well, one of the worst things about getting tangled up and not passing the Build Back Better is that if they fail, leaves people feeling, well, the Democrats are failing, so let's go vote for the Republicans. And that is not what we need. We need to do something to bring the Democratic Party to recognize their need to speak for ordinary people instead of looking at who's giving them lots of money and who all these lobbyists are, et cetera.
Well, I think Pamila's bill just got its, did I see 118th co-signer
I hadn't seen that. That's
today?
nice.
The guy from California who voted for Medicare for all 2 or 3 years ago, but hadn't signed on to her recent bills.
I think in answer to that question, which might have been rhetorical, but I think the only option is actual leverage. You know, the Democrats, if they want to retain power in the midterms, this is their chance. They have a chance right now. Like Republicans have already gerrymandered certain districts. It's not looking good point wise, and they have to deliver for the regular people between now and the fall. This is their chance if they don't want to switch power, you know, and I hope the Democrats care about that. But I think like if Pramila Jayapal does, that's one way to kind of articulate it. And I think call out the corporate Democrats that are going to obstruct this, you know, like go to Joe Manchin's, go to West Virginia. That is the guy that has been obstructing this. If they would go to West Virginia and campaign, because the one thing that he gave into was when Bernie went to his backyard and when the vice president went there and shamed him for it. Because there's no way, like, yes, people are Republicans, but they're not, there's the poor people there still want Medicare, you know? So I think that it's time to play dirty in that regard, you know, dirty in quotes.
The Democrats had leverage when they did pose to exert it when they said, we're not going to pass the infrastructure bill unless the BB bill is passed with it. And they gave that leverage up. I think last week they said that they passed the infrastructure bill.
Yep.
And so now the BBB sitting out there and there's no leverage. I mean, so the Democrats, this is how the Democrats work. I mean, they threaten these kind of things. They say, we're going to do this leverage and we're going to make sure that this gets passed. And we're not going to do this unless this gets passed. But they fold. And that's so typical of the Democrats for the last 30 years.
But I kind of see, as a voter, I feel like it's the Washington Wizards versus the Harlem Globetrotters. Like they need to we see through that. No more of this heel, like the paid heels, you know, like the cinema. They need to shame the heck. Cinema, that's, I guess she's like the big cryptic one, but she seems to care about when people shame her. Pardon?
Money.
Yeah, just call it out. Just call it out. But I just worry as a party, now is their time. It's going to be a missed opportunity when the power shifts to the Republican side. And it's really going to screw like, I mean, now that I'm a dad of kids, like I worry about climate change. The time is now, you know, but in a lot of ways, the opportunities right now. So, I mean, Pramila, whatever, if she's going to, I don't know, when Lyndon B. Johnson pushed Medicare through, he bullied, and the Civic Rights Act, he bullied people to do it. He wasn't nice about it. And that's the only way in this cynical country that we live in is to get stuff passed. You know, there's no like nice time for nice politics at this point. You know, for whatever that means to Pramila Jayapal to put the leverage on. But I think go shame Joe Manchin. Let him live with the shame of that he's going to he's doing this to his own constituents, the poor people, the people that are not like going to benefit off of the coal country, you know, all his industries that he has a conflict of interest with, you know.
The person that should be doing that is Biden.
Yeah.
He should be shaming him.
But why won't he?
I think because he's Biden and not LBJ.
Yeah.
So LBJ would have Manchin in there and say, would you like to see this about your conflict of interest all over the front pages of the newspaper and on Fox News and every other place? Or are you going to vote for this bill? Something along those lines, are the kind of thing that LBJ used to do.
Not to mention, though, that Joe Manchin's daughter has the EpiPen scandal. You know, Biden.
I didn't know that.
Yeah, Biden could pull Joe Manchin in and be like, look, I have two options. You could be, option one is the FBI investigates this EpiPen scandal with your daughter. And I also look, you know, we look into your conflict of interest with how you vote versus your business contacts. Or you vote for my stuff, and what do you know? Maybe I put a military base in West Virginia or some kind of thing, you know, and you can look like a good guy, you know. I mean, it wouldn't be hard for Joe Biden to bully Joe Manchin a little bit, you know. But it's just I'm just spitballing things there. But
well,
you know,
he has claimed that all of his coal interests are in a blind trust, but I just saw something today or yesterday that showed that that's a bunch of baloney. He knows about it, and they've got him on record as knowing what's in his blind trust and figuring out how to push it.
You can Google it. There's a lot to indicate that Joe Manchin is very aware of his financial. He has a lot to gain to like kill like the Green New Deal and stuff like that. Like he's, but I mean the EpiPen scandal alone with his daughter, like Biden could go after that with the FBI. Now I'm not. That's probably beyond like Biden's like sense of Machiavellian chess playing, but I just know that there's like way too much at stake. You know, I don't think like I wish Pramila would not just rely on when she says I trust and have faith in the president. I just see them getting stabbed in the back the way they just got stabbed in the back when they just coupled the infrastructure bill from the Build Back Better. I fear for that. As a citizen, I've given up on it. You know, I think political leverage is the only way that any of this is going to get done. I'm sincerely scared of a lot of this stuff.
Me too. I'm sorry that it come to this. I think our country is failing, and I don't like that.
Okay, so what are we going to be doing as a chapter in 2022 to join and lead the army? Get our politicians to follow us, right? The grassroots has to lead, and the representatives will follow.
Well, we have been working on trying to contact Washington State members who have not renewed recently. I don't know. I got 2 people who said they would, and one who is interested but doesn't want to have to pay as much in order to be a member. I have to answer her.
And we have a list of 105 quote lapsed members that the national organization sent us that were quote low-hanging fruit who have paid significant amount of money within the last 4 years, you know, even above what their membership renewals were. We're tasked to contact those people and see if we can get them to rejoin, because it's, you know, their dues are at least 12 months out of date. Contact those people. So we have a list of all their email addresses, not all of which are accurate, because I know at least a couple of people have died who are on that list. All I've done so far is just send out a blast, you know, individually to, I think, 20 people that I have emails for. I just got one response, who was somebody from WPSR who says, why can't PNHP and WPSR work more closely together about these economic issues? I responded, we tried to do that 3 or 4 years ago. Remember, we had what's his name, who's the head of the economic, WPSR has 3 things they're looking at, economic disparities, nuclear weapons, and climate change. So we got the guy in charge of Pishruska.
From UW.
Yeah,
Oh.
UW, Steven.
Steven.
Stephen Berneshka. Oh, he's he's one of my doctors.
Well, anyway, he says, well, the only thing that matters are social determinants of health. Access doesn't really help, because if there's too much access, people get overtreated and they die from overtreatment. So that was about as far as that went. We had him for, I think, as a speaker at one of our monthly meetings about, must have been 4 or 5 years ago, which, you know, I think he was going a little overboard to stress a point. Anyway, WPSR does not work on healthcare reform.
I didn't get any response from the people that I sent emails to. Is PNHP gonna let us know if we get a response? If they get a response, like if people just send in their dues and
I think they will.
to national?
Like a Google spreadsheet that I think you enter information in and it goes to the national. Hugh Foy, who was out of town tonight, I think he got responses from 4 or 5 that were no good emails, but he did get, I think, responses from at least 2 and maybe 3 or even 4 people who said they would renew. So I thought the next thing would be to send emails, send regular letters to the people we have addresses for, you know.
Right. I've been working my way down the list. I've been doing 2 a night because I write them personally. And I pick up something about each of them that's personal. I've invited all of them to come to our monthly meetings. And I've pointed out that since they're on Zoom, if you're in Yakima, it's a lot easier to come to a Zoom meeting than to have to drive over the pass to join us, et cetera. So I've been putting some personal stuff in, and I've gotten some responses. 2 have definitely said they would renew. One, of course, I'll take all the credit, but it's Hal Stockbridge. And then I got this interesting one from a doctor at, I think she's at the U. She has just retired and would like to continue to support us, but is not intending to be more active. And doesn't want, since she's retired, she's starting to really look at her whole card when it comes to money, doesn't want to pay as much. So I haven't answered her yet. I want to talk to the folks at PNHP and find out how much do you have to pay in order to be counted as a member? Do they have a rate for retired physicians?
They do, and it's about half they bumped up the regular rate to $250 a year, I think, and I think the retired is $125. But they'd be happy to take a contribution of $20, and you'd be on the list and be counted as a member, no matter what your status is.
Right, but I want to be able to say that to her with some authority. Have you checked on that with National? Because I want them to respond to her. If she gives them, say, $50, would they respond to her and say, welcome back, we're glad you're a member again and you're part of the Washington chapter? I'll communicate with National. That was just yesterday, and today I have not had, I have had a little bit of time to go to the bathroom and eat a pizza.
Well, on this activist call tomorrow night, that very same question might come up if we talk about the lapsed member campaign.
Would you?
The PNHP national chapter is, as I said, doing a lot more stuff. And this lapsed member campaign, they're putting a lot of effort into. The other thing is, I think we could beef up our social media. So I think somebody from the national who's a communication specialist would be willing to give us some training on that. So I think that's worthwhile doing that. There's another thing.
Thanks.
I think I sent you guys information about Glenn Anderson. Just an amazing guy who's been around since 1960, involved in all kinds of stuff. And he just gives away his time and his expertise. I'm taking the 5th out of 6 seminars next Monday, but he has these 2-hour seminars for people 6 consecutive Sundays, or if you wanted to do Mondays, you did Mondays. I talked, and we're getting down to, I think I sent out some information to some of the last handouts we were talking about. But anyway, I think he'd be willing to give us an hour or 2 seminar on how we could make our chapter more efficient. And
I would love that. Could we do that for like our monthly meeting in January?
Well, I think it probably should be a 2-hour session. Yeah, he's willing to do just about anything. And, he doesn't put you on the spot. He's talking all the time, but spewing out good information. So, yeah, and he said he'd be happy to do something like that for us. So should we try to do it as a monthly meeting for 2 hours, or ask him to
I would love that if he would be willing to.
Yeah, I'm sure he would. We could ask him just to pare it down to 1 hour and a half too. How to avoid dry rot in your organization, I think, was one of the handouts he sent out.
Dry rot, is that what I am?
One of the points is that people who have been in the organization for a long time kind of suppress the newer people, and even though they don't mean to. I sent it to you,
Yes.
Dana, didn't I? Those 3 files.
Oh, yes, I got those. They're very interesting. I think it'd be a great idea to have Glenn come and give us a spiel on expand our organization. And
So anyway, that's a good idea. And
Oh, it sure is. I think you all know that I interviewed with him for his show that he puts on, whether it's once a week or once a month or whatever, but he interviewed me and it was really very nicely done. I had to drive down, this is long before COVID, drove down to Olympia and visited with him where he does the TV stuff. Wonderful guy.
I was on his radio show about 4 years ago.
But of course, for this, he wouldn't have to come up. He can, because we can do it all remotely. Are we ever going to be willing to go back to meeting in person when we have all the convenience of not having to travel anywhere in lousy weather?
I can't believe it would even be possible for the next year.
Yeah, we're only halfway through the Greek alphabet. Dana, I learned that Omicron is like the 15th letter. There isn't, we were talking about Omega, which is the last letter in the Greek alphabet. Omicron is another letter, and it's only about halfway through. So I think we have a ways to go alphabetically. And then there's the flu season, right?
Right. Well, the best thing about everybody wearing all these masks and everything is it's really going to cut down on the transmission of flu and never mind regular colds.
So is PNHP considered reaching out to recruit doctors or to reach out to the low-hanging fruit who are still alive using, this direct contracting industry entities, or they probably should be called indirect contracting because it's like a black market, and it's I think we're good. We're already seeing the insurance companies buying up these little contracting companies. Is that something that docs in this area will hear? Is that an email attempt to get people to join? Throw out a couple of articles.
I don't think anything has been implemented in this area. I mean, no doctors have been asked to join.
Well, this would be preemptive, like planning ahead to prevent it from happening. I think now that's what PNHP is calling out, is to get more people involved to make sure that it's doesn't go, or to try to prevent it from going beyond a project or an innovation project to becoming universal rule.
I think it's hard to get at the doctors because most doctors now are working in large groups, or they're employees of mega hospital corporation things, and they don't have any freedom at all to say what they are or aren't going to sign up for. Their paycheck comes from their keeping their heads down and seeing their patients and not worrying about how all of this is happening.
Well, I don't think anybody has a choice. It's happening behind their backs.
That's right. And so it's, and not only that, but the doctors don't want to lose their jobs. And so if they become a squeaky wheel and belong to some nefarious organization like PNHP that's trying to do away with DCEs, then their venture capital owner of the practice might toss them out. So it's hard.
Well, can we find out which politicians are there any primary politicians we can target who are pushing it, or
It's not happening in the politicians. It's happening in CMS, isn't it?
Oh, that's right. That's right.
And that's who Susan Rogers went and a group of people went to see a couple of weeks ago, and who have an opportunity to see them again. But I was just thinking of this as a way to educate doctors, or to pull a couple of videos or articles together and distribute it to the low-hanging fruit who were members of our chapter before, in order to pull them back in, saying this can't happen. We need to stop this from spreading.
To his credit, David put it in his cover letter to these low-hanging fruit people, and I included it as well. They're sort of aware of it on the surface. I'm not sure they see what it is in depth. We would have to develop a more substantial document. And I think it is, David, you were on the One Payer States call where that gal from Bellingham said that she is being signed up in a DCE. And she, I think she wrote a letter to the editor or something like that. Didn't you hear that?
It was
Maybe
Sherry
you brought
Lambert, who has come to a couple of our meetings as well. But I don't know, I don't think that patients are being told they're in a DCE. I think she was switched. You
No,
know,
that's correct. They
her
are, but it
program
is
was
here.
switched outside of that in another program, you know, from one Medicare Advantage to another, from what I got from her.
Yeah, I don't think it was a DCE.
Well, it could be,
there's
because what
certain-
can happen is that her doctor gets signed up for one of these things, and then that doctor's patients get assigned to the DCE.
But she was clear that it was Peace Health, Bellingham, and
Right. Right.
and that it's not happening at Peace Health yet.
Oh,
All kinds of other crap is happening at Peace Health, but that's not happening yet.
Yeah, but that would be a good target for a demonstration project. But definitely it's there because I think they tried to implement this in workers in New York City who worked for the New York City government.
Right.
That was one of the geo things was going to be implemented, but union or somebody got word of it and said, oh no, you're not going to do this. But they were going to switch all those people into this DCE without telling them, you know, thousands of employees of the government of New York City.
well, that are on Medicare?
Yeah, retired.
Tired, yeah.
So you answered my question. Thanks for being on top of that. I think that's something that PNHP is doing that is just outstanding to, you know, to be fighting, you know, getting their feet inside the doors of CMS. And
Yeah, I think that's pretty exciting. So we'll see whether we can keep and even expand our membership using work that we have done and accomplishments that we have made. If they actually do suspend the DCE program, that would be a major accomplishment for us that we could then brag about in attracting more members. Still falls back on the fact that our real strength is physicians and allied health professionals, but it's increasingly hard when they're not independent.
Has the California's nursing union said anything about it? Because they're usually pretty strong. They have a pretty strong political voice.
I'm sure. And they were the ones that got behind that representative from California to sign on to Premilla's bill just a few days ago.
I think the key thing is to generate as much public outrage as possible. And inherently, if CNN or an MSNBC even does touch upon it, the donor class, they're going to try to make it an ideological argument of private versus public. And we need to squash that. It's Wall Street showing up to the trough to eat from the trough of public funds. There's no ideological argument to be had here at this point. You know, like we don't need other animals showing up. This was Medicare, you know, its admin costs are very minimal. And you know, suddenly doing means testing and austerity and whatever the hell they're going to apply to it to keep their costs down, like that's just going to screw it up. You know, I don't want to lose the message war on that. That would inherently pop up. I think it's an easy message war to win, I think, right? Given that I mean, they're not even talking about it in the media, but I mean, like, I think public outrage would be one way to, like, as much as you can generate, it would be one way to, you know what I mean? Like, as you say, like, not enough people even really know about that this is going on, right?
it's the hidden benefit companies like pharmacy benefit managers and other groups that we don't know anything about.
And they won't tell you. I try to ask when I go to pick up my medications, and the pharmacy won't tell me anything.
Well, we
about
don't
what
know.
their
We get a
real
card
cost
that
is.
says Primera Blue Cross, and then when we submit the payment, it goes to this number 77428 or something like that. And then we have to deal with their limitations. And then we get another Primera Blue Cross that says 52286, and it's some other benefit manager that's owned by somebody else, and they have different requirements, and patients get caught in the middle, switching stuff back and forth. Unfortunately, sometimes taking both medicines that your pharmacist is not telling you because we have no idea. They don't identify themselves. And the Pharmacy Association realizes what a major problem that is. But there's so few laws managing pharmacy benefits and laboratory benefits and medical supply benefits. And, it's not just that one issue. It's a big part of why our system is dependent on making a profit.
So Ronnie, as a pharmacist, why isn't there a pharmacist for a national health program?
There is.
There
We
is?
meet the second Tuesday or Monday of each month. I've been arranging for Pramila to come and talk to the group. The head is actually somebody, a pharmacist from New Jersey, who responded to some of the requests from different organizations like PNHP to go out to their senator. The New Jersey senator was saying that Medicare doing drug negotiations should be returning money to the Medicare funds rather than expanding Medicare services to include dental and vision and decreasing copays and things. And he wrote a letter to the editor. So it's a small group of people, but it is spread across the country.
How long has it been in existence?
It's just been around maybe 2 years at the most. I met them and got involved at a One Payer States conference. So it was about a year ago that I connected with them. And it's everything I can do not to become the president of. I've been trying. It's really hard.
What you mean?
But it's people that are in schools or, working in different pharmacy schools, people that are doing consulting pharmacy, people that are in chain pharmacies. It's a really nice cross section of people. And they've had some editorials in pharmacy journals, and a couple of the key members are from Chicago and are very connected to PNHP leaders there and have attend PNHP meetings in their individual states. So there is one. And it's called Pharmacists for Single Payer, but it's small and slowly growing. But there are issues that even our state pharmacy association, which involves mostly small businesses rather than hospitals or chains. But actually, hospitals are a big part of our hospital pharmacists are a big part of the organization. Has their number one issue is to, battle against these pharmacy benefit managers, make them more transparent, and they've also have testified when we've been pushing some of these drug affordability boards or other bills in Washington state.
Well, that's really nice to know, Ronnie.
Yeah.
Is there anything, like when I go down to pick up my drugs at Rite Aid, is there anything I should give the pharmacist to try to recruit him or her?
Give them my name and number.
Okay.
I can share it with them, and certainly getting them to involve and join PNHP. They have memberships for non-physician members that are lower than the ones for physician members.
Right.
So talk to them about both.
I will do that. It'll be in the new year. I just picked up my last prescription for this year.
Yeah, so it's just about the time for New Year's resolutions. Let's commit to make at least one about pushing healthcare for all justice forward.
I tried to Google it, physicians for single payer.
Pharmacist.
Pharmacist.
Sorry, I misspoke. Pharmacists. A Facebook page came up actually. It said it's private group with 5 members. But I joined. I just clicked, hey, can I join? But here's the link for. I'd like to read the newsletter.
Pharmacists for singlepayer.org.
.org. Okay. Yep. Then this is it. It's like Facebook is like the laziest way to stay in touch, but it's like a quick way of information too. Sometimes if they're active in promulgating things.
But I think that's neat that there is a pharmacist group, Ronnie, and I will remember that the next time I go to the pharmacy.
And it certainly was directly, came out of work with physicians for a national health program. I don't know who the individuals were, but there certainly are a lot of activists in Chicago area.
So how many congressional districts are represented here tonight in this meeting? I think most of us are in Pramilla's district, which is that 7?
That's 7. I'm in 9, which is Adam Smith's district, and he signed on to Medicare for All a couple of years ago and has stayed
Right.
involved.
No, I'm thinking of signing on to Pramilla's DCE prevention bill or letter that she's drafting. So if we could encourage, all of us can encourage our local congressperson to sign on to that letter, that would be something we can take away tonight to do.
Right. I am sort of lazy about that because I'm guessing that Adam Smith probably has, but I can send an email just in case.
So Andy, are you, and Margaret Walsh, you're probably not in Pramilla's district, right?
I live in Seattle, so doesn't that fall under Pramila?
Yeah.
Most of it does. Where in Seattle?
Right by the U district, your East Lake Union.
That's Pramila, yeah.
I'm in the 8th, Kim Schreier.
Oh,
Yeah,
Yes.
go after her.
yeah.
Yeah.
Of course, she's scared to death about all the Eastern Washington folks, because not only does she have Eastern King County, which is not exactly a hotbed of revolutionaries, but she's got Chelan.
Well,
She was on one call that I got to participate in. She said, I'm just so concerned about the people who aren't signing up for the ACA. It's just sitting there, it's free. And I had to call her office and said, no, the ACA is not free. We pay a lot for it. I remember I ran for that office. I tried to unseat Dave Reichert. I got 2,300 votes on the Planetary Peace Movement
wow.
platform, audit the military and Medicare for all. It only costs $1,700 to get on the ballot. You don't even have to have $1,700. All you need is 1,700 signatures. Get on the ballot, you guys, and just for $1,700, your platform will be in a voter's guide.
Wow.
And there will be people reading it. And there'll be there's a choice. I would do it again in a minute.
Well, I'm going to have to settle for
Thanks.
my son, who just won a seat on the Mercer Island City Council.
On a single payer platform?
Well, fortunately, the Mercer Island doesn't really have much to do with that. But he is a very earnest, middle-aged man, and walked to every precinct on Mercer Island.
I was on another call this week or last week, and Indianapolis is not only a city, it's a county. And they got 6 of their 7 council members to sponsor single payer. And the kid, it was just one guy, a comedian, who befriended one advocate. And he got the whole city council of Indianapolis to support Medicare for all. They want their name on the list of people in the country who support House Resolution 1976. It was just so inspiring. There was another community So their angle is just go for the local city board, because imagine the relief to every state, county, and city government no longer having to provide a lifetime of health care to every firefighter, librarian, and the family. So if you go to your city and you say, look how much money, because it's public information, how much money you would save the city taxpayers, the county's taxpayers, then the city council might say, yeah, we want to save that money. Anyway, they did it in Indianapolis. I
Okay,
have the lady's name down here, FYI. So, it's happening in many ways.
One of the victories Healthcare as a Human Right Washington claimed was getting the Universal Healthcare Commission established. And I think it's had one meeting that I was going to check out, but I had something come up. I couldn't. Did you attend that meeting, Sherry?
yes, I did.
What happened? Was there anything accomplished in that? Because the second one's coming up.
Right. There wasn't anything really accomplished other than introducing themselves to one another and explaining why they were there and what caused them to get involved with doing.
And there
it.
was a long presentation on the open public meetings.
Oh, that's right. 20 minutes was devoted to that, which is important and has affected us, hasn't it, Ronnie? In trying to, we can't invite as many of them as would like to show up to come and talk at one of our Healthcare for All second Wednesday events, because that would violate or at least look suspicious for the Open Meetings Act. So I think
hopefully January 4th will be before the legislature starts. So at least the 3 legislators who are on the committee, there's supposed to be 4, but Ann Rivers is not going to show, or it has a city job or county job.
I think she resigned from the legislature.
Yeah.
And so there's nobody in the Republican Party. So she's supposed to be the Republican senatorial choice. And I think the Republican establishment in the legislature hasn't come to grips with the fact that they need to appoint a replacement.
But January 4th meeting should have all the attendance there. So hopefully there'll be some action. I have not seen an agenda yet.
So
No.
Are you on that commission, Ronnie?
No.
There are 1 or 2 people from Healthcare for All.
6. Well, there's 6 people that we all, Healthcare for All and Healthcare is a Human Right, and various of the 39 supporters of healthcare participants in that alliance, the Healthcare is a Human Right Alliance. There's 6 people that we recommended, including the chair. So there are some great voices there. Health economists from Washington State University. It'll be something to watch. I think there'll be some action there.
Are there like 20 seats?
15.
15?
15.
But it looks like at least 7 of them are pretty solid, universities.
Well, 4 of them are politicians and 6 of them are state employees or lawyers that work for the state in different positions. That means that state agencies will be taking action or a part of the action. So it certainly is not a panacea. It's going to be hard, watching federal action and trying to prepare for it. Does the state have to shift gears when they start some crap like DCEs, or maybe we should be calling them indirect contracting entities because they're hidden and they're just getting in the way. They're not making things more direct, they're making them more indirect. But when stuff like that comes up, we're going to have even more trouble getting things started. So, but it's exciting to see things happening on that state level, and having 6 state agencies involved should be powerful.
It has potential, but we'll see.
I think it's called direct because the private industry is directing how Medicare should go.
But like everything else, it's got to be Orwellian, right? It's got to be like 1984. Like it's about it's about choice and freedom. When you diminish people's freedom for healthcare, well, that's actually giving you freedom.
Well, we're joking about it, but it really is United Healthcare that's moving into there, buying up some of these little companies, trying to reverse what little the Affordable Care Act did of setting up accountable care organizations or something. Something did happen with the Affordable Care Act on healthcare costs. It's probably a confluence of different factors, but something happened. Things are starting to turn around, but I think everything I've read, which has been limited, I've heard Steve Kimball talk, and there was a series of articles in Health Affairs magazine, which I read abstracts of, let me be honest. But they're saying there's data that they're saving 1 or 2%, but they're getting paid $4 or $5 billion more than if the individuals were in traditional Medicare. So that 1 or 2% is not moving forward, it's moving backwards. So we're joking about it, but it's a very real loss of real dollars.
It really hasn't improved patient care either.
Oh no.
The ACOs.
It's limiting what a doc can do, what a group can do. It's putting another layer of non-transparent requirements and forms and requiring them to, add disease state categories that don't exist. And it's scary.
Well, that's how they floated out the ACOs when they first came out. They said, we're going to improve patient care. We're going to make sure these doctors get their diabetics A1Cs down. We're going to make sure that people's blood pressures are controlled. And by that means, we're going to save money. Yeah, never happened.
Well, and then what they did was they gave the doctor a sheet of, well, this person has diabetes, but you can add, possible Fragile X syndrome, possible cardiovascular, possible kidney. And so you're monitoring all that, put in that code, and you'll make more money with us.
Right.
And it's called, we all know what it's called, right? Fraud.
Yeah, it's upcoding, and that's been around forever. Well, for a long time. But it's fraud, and it's fraud that it did not improve patient care at all. In fact, I think it got worse for a lot of patients.
Yeah, that's what Steve Bezrucha is talking about, like people going to doctors and getting another diagnosis and another medication that they might not really need.
The VA has this where they'll farm some stuff out if they don't have the care within their facility. It's not quite the same. And I'm definitely a big proponent of the VA, but we have this third-party entity, and then they set it up for the outpatient care. But adding that extra layer of bureaucracy means always time lost for me and for anybody else. It's never, anytime you have to insert one more layer, it means that's like weeks or a month. If the VA has to have me do like some specialty care doctor that's not at the VA and they have to use some outside thing, they have to go through this third party. But that third party always, just to process the admin part, it only adds to the time of getting care. It never makes it go faster. So even if Wall Street's stepping in like this, or United Care wasn't going to make any money off this, they're still going to be delaying they're going to delay the care for you.
They're making money. They're making money.
They're definitely going to make money. But I'm just saying, even money aside, it's one more level of bureaucracy. It's going to delay your ability to get care, I think, if it's anything like what I experienced with the VA.
I was just thinking on this Omicron where it's spreading faster. And recently there's a thing that has a 20-day lag on the number of deaths. So all this reporting of how it's less, let's call it offensive, it has another influence on what you guys are kind of talking about there in the sense that I know with our whole Washington initiative, which sometimes helps in developing people's interest and follow through, that the reason why we failed to collect signatures was listed as the fact that everybody was having trouble with people cooperating with signing the initiative. So going forward, we might have less education going on in a certain sense by the fact that this continuing plague, I'll call it, is kind of inhibiting us to do action on at least that one front on an initiatives or referendum type style of activation or activism. But I don't know what some people think on that, but it has, as I see it, it has withdrawn one of the tools that some people are having to resort to, which is, to go beyond the politicians.
There was a Saturday night skit on Zoom meetings where people were in person in a building or in a meeting room, and one of them started mumbling really low, and everybody said, "You're muted. You're muted." But a couple of docs from Physicians for Social Responsibility will be presenting at our next Healthcare for All second Wednesday speaker program. It's Chris Covert-Bowles, who's vice president of Healthcare for All this year. But another doc from there will be joining him to talk about the health impacts of climate change. And it's something that the Senator Cleveland, who's the chair of the State Senate Healthcare Committee, Health and Long-Term Care Committee, really was asking us about was the health impacts of climate change. So it might be a way to bring in a few more docs to this organization as well. So, maybe come up with a question to ask at it'll be January 12th, the second Wednesday in January. That could, bring up Physicians for a National Health Program, and hopefully Chris will bring along or will attract some other members of Physicians for a Social Responsibility other than Steve Bezrucha. They'll, attract some other people. So it might be a good confluence for PNHP to ask a question that includes or says something about yourself. You're more than welcome to do that. So that's January 12th, 7 p.m.
Have you sent out the blast about that yet? Because usually
Not yet.
Well, send me the information because I'm sending out our monthly report in a day or two. So I want to include that.
So as soon as we get the name of the other speaker, I should do that in a couple of days. Thanks, David.
Sure.
Okay, and meanwhile, I'd like to remind folks that we have board meeting, PNHP Washington board meeting, 11:30 on Zoom this coming Sunday, which is the 19th, I believe. Exactly 1 month before the third Wednesday of January, which we hope will be Glenn Anderson.
That's another thing that we want to recruit some more board members. So anybody here interested? We might put a finger on you.
If anybody is at all interested, let David or me know, please.
Yeah, I think Andy, sounds like you'd be a new voice, and you'd reduce our age by about 20%.
Yeah, I'm happy to do it. Like I said, I've been MIA for two years because my wife gave birth to twins, and then the pandemic hit, and so I've been busy. But the fact that, and I've been and other stuff, we're trying to buy a house in this crazy, insane market in the Pacific Northwest, and it's just. But I've been following the stuff, the news, and especially this what we're going to call it an indirect. And I don't know if you remember me, Ronnie. You gave me a ride home from an event. Do you remember you gave me a guy a ride home to Eastlake?
and you live next to that school, Tops Elementary School?
Good memory. Yeah. And was that because there was an economist there? That's when I kind of like put myself on David's radar, because there was some economist pushing some BS talking points saying that the reason we can't, Medicare can't negotiate drug prices because of some economic reason. And I was just like, or because a corrupt politician who, they voted on it overnight, and it was a revolving door. That guy didn't like me.
It was a PNHP. It was a PNHP meeting with some staff from UW, and I think David McClanahan was one of the speakers. I wonder if David McClanahan was the one who said that to us.
No, David liked me.
What the hell?
No, this guy, and one of the things he said, he goes, no federal agency has negotiated drug prices. And then I was like, that's not true. And I was like, and he
what
goes,
about the VA?
That's
Yeah,
what
VA.
he was like, oh, you mean the VA? And I'm like, that's huge. California just had a bill where they were going to match drug prices to the VA or whatever around that time period. But yeah, that's when I remember you. And then, like I said, I've just been, but I want to try to it's nice now that we have Zoom, and I will, obviously I'm passionate, I'm from a fearful place. I can't believe I'm in this place. We want to expand Medicare, and now I'm worried that it's going to retract. And, I'm in a socioeconomic status where I see a lot of the negative impacts from the last administration, like this whole thing where Trump delayed the taxes.
Thank you.
Good night.
Thank you, David and Sherry.
Thank you all. Bye, everybody.
Yep. See you on Sunday.